Welcome to the Aced It podcast, where we turn science into sense. This is the 14th season of Aced It, and we are so incredibly grateful that we are able to deliver rich scientific content to you in a usable and understandable way. Aced It is brought to you via the Justice Community Overdose Innovation Network, or JCOIN. If you're new to Aced It, welcome. We're so glad you're here. And check out the prior seasons to begin or continue your learning journey. A special thank you to every wonderful listener. We promise we will continue working to help you learn and grow via Aced It. Also, a quick plug for a few other JCOIN features. Did you know you can get technical assistance for your organization from the experts at JCOIN? And did you know you can apply for a small research grant to help fund an innovative study idea? Yep, through JCOIN. And did you know you can apply to be a JCOIN LEAP scholar or investigator, a year-long mentorship that will improve your skills? Also through, you got it, JCOIN. If any or all of these exciting offerings sound interesting, check out our website, jcoinctc.org, and learn about the many JCOIN courses, products, and opportunities beyond Aced It, all designed to translate science into sense for you. With that, I am honored that you're with us. I'm Danielle Rudes, your host, and this is Aced It. Welcome to the Aced It podcast. This season, we're exploring the narratives told about drugs and overdose, who gets to tell them, and the narratives they choose to spread. Ultimately, these narratives shape stigma, guide policy responses, and affect access to treatment. Today, we're focusing on healthcare professionals. Doctors, nurses, pharmacists, emergency providers, these are the people many of us turn to when we need help. In this episode, we'll explore how stigma forms within the healthcare systems, how it affects patient experiences, and why changing these narratives may be essential to addressing overdose and improving care. Let's start with the scale of the problem, because that really sets the stage for how healthcare attitudes matter. Substance use disorders remain a major public health issue in the United States, but access to treatment remains extremely limited. One national report by the Substance Abuse and Mental Health Services Administration, or SAMHSA, found that about 14.9% of people ages 12 and older needed treatment for substance use disorder in 2020, but only 1.4% of those individuals actually got the treatment they needed. That is a massive treatment gap. At the same time, the CDC reports over 70,000 overdose deaths in October of 2019, most related to opioids, an estimated 30% increase in opioid-involved overdose deaths from 2019 to 2020 as the COVID pandemic hit. That statistic comes from research by Cernasev and colleagues 2022 and Spencer and colleagues 2024. However, the gap between need and treatment is not just about the availability of services. It is also about how substance use is perceived. The way healthcare professionals understand addiction influences whether patients feel comfortable enough to seek help, how seriously their concerns are taken, and whether they receive the most effective plan. Well, what do healthcare professionals actually think about patients with substance use disorder? Research suggests it's a mix. Cernasev and colleagues 2022 examined soon-to-be medical and pharmaceutical professionals, and what they found was that many of them saw substance use disorder as a disease, not a moral failing. Several described moments of empathy, with one participant sharing, quote, "It could be me," meaning it could be them suffering from substance use. Another participant talked about working at the needle exchange program, where they would gently tell every patient that they saw, quote, "I understand what you are going through. I have resources to help you when you are ready," unquote. And according to this participant, this approach had great success in getting people into recovery programs. But we don't hear the same story everywhere. Munkin and colleagues 2020 conducted a study of people who inject drugs in New York City and found that about 78% reported at least on stigmatizing experience with the healthcare system. Nearly 72% described direct, enacted stigma, things like being dismissed, disrespected, or denied appropriate care, and almost 60% expressed anticipating stigma before they even walked into the door. In another study, Paquette and colleagues 2018 called it, quote, "stigma at every turn," unquote. Instead, These individuals were in California, but they still overwhelmingly described instances of being denied syringes at pharmacies, treated poorly by first responders and hospital staff, and facing stigma, even in drug treatment, particularly around the use of methadone. For some, the fear that others may perceive you as a junkie changed how and whether they sought out care. In Biancarelli and colleagues' 2019 Northeastern study of people who inject drugs, participants described dehumanization in healthcare settings, stating that they were often made to feel that they were being treated unfairly because of their drug use. The researchers found that many participants would develop strategies to avoid this. They would delay getting care, they would hide or not disclose their drug use, they would downplay their pain, or they would try to find care elsewhere. Actually, many of these same participants describe syringe service programs and community-based organizations as places of, quote, greater acceptance, mutual respect, and stronger connections with staff, unquote, all within the same city. If you're interested in learning more about those spaces, I'd encourage you to check out some of our previous seasons. Anyway, stigma isn't just about individual interactions. It's also reflected in how many healthcare providers understand addiction and treatment. Parrish and colleagues 2024 surveyed a total of 1,240 primary care doctors, emergency physicians, and dentists to examine the prevalence of provider stigma toward individuals with substance use disorder. Through this research, they found that stigma toward people with substance use disorder was higher than stigma toward other health conditions like diabetes or HIV. Emergency physicians had significantly higher stigma scores than primary care providers, and primary care providers had higher stigma than dentists. However, one of the many important findings in their study was that lower stigma was linked to better clinical practices. That means providers with less stigma toward an individual with a substance use disorder were more likely to offer them referrals and prescribe medication for opioid use disorder. How great is that? Actually, wait, that is incredible. While some research, like the findings from Parrish and colleagues 2024, suggests that emergency physicians have a higher stigma against people with substance use disorders, we also have to think about what these interactions may look like during the moments of acute crisis. Emergency departments treat hundreds of thousands of non-fatal overdoses each year, coupled with the other several hundred reasons people go to the emergency room. Yet, according to Frederic and colleagues 2021, many patients choose to leave the hospital before receiving further evaluation or treatment. Some researchers argue that these decisions are irrational or caused by impaired judgment, but as Frederic and colleagues 2021 explain, these choices may actually reflect a patient's previous experience with stigma or discrimination within a healthcare setting. If someone expects to be judged or dismissed, leaving the hospital may feel like the most reasonable or safest option available to them. Emergency physicians are also often navigating overwhelming workloads. In these high-pressure environments, both providers and patients may be responding to difficult circumstances in ways that shape how care ultimately unfolds. In addition to this, soon-to-be providers have also just felt that they have not received the training that they need for addiction treatment. For instance, individuals who participated in the study conducted by Cernasev and colleagues 2022 often reported feeling uncertain about how to support patients with substance use disorder. But they also point us toward a solution. Much of this research highlights the need for more training in listening, emphasizing, and counseling people with substance use disorders, not just trying to memorize pharmacology. Interventions that bring people who use drugs into the classroom as educators, as experts in their own life, has been recommended by Muncan and colleagues in 2020 as a way to help reduce stigma and increase empathy. Even small shifts like using first-person language are highlighted by scholars like Biancarelli and colleagues 2019 as a necessary piece of training for everyone who interacts with patients. After discussing only some of the information out there about healthcare professionals, one thing is clear. There isn't one story. There's the story of the student who sees it could be me and offers harm reduction with respect, and the story of the emergency room where someone in need of help lies about their drug use to be believed, the research reaffirms that stigma pushes people away from care. Let me just say that again. Stigma pushes people away from care. And that empathy, meaning harm reduction, evidence-based treatment, all pull people back in toward care. As listeners and clinicians, as people who vote and advocate, we have a role in choosing which story grows louder. One where healthcare is another space of exclusion, or one where it becomes a genuine doorway towards safety, dignity, and recovery. Thank you for joining us. We'll see you next time. Thank you so much for listening to the ACE-IT podcast. We love hearing from you, so if you have comments, topics to suggest, or some science you'd like us to cover in a future season, please write to me, Danielle Rudes at Sam Houston State University. My email is drudes@shsu.edu. And of course, thank you to the Justice Community Overdose Innovation Network, JCOIN's Coordination and Translation Center, funded by the National Institute on Drug Abuse, housed at George Mason University, where this podcast originated. Thank you to our fabulous scriptwriter team and also my fabulous doctoral students at Sam Houston State University, Bryce Kushmerek-McCune, Jalen Magana, and Alexa Mata. And a huge and a heartfelt thank you to the team at Slonky LLC for their wonderful podcast production as always. Tune in again soon for another episode of ACE-IT.